Hi, this is a quick presentation, relatively quick, to talk about the autonomic nervous system and its relevance to paramedics. So, just a place where the autonomic nervous system goes, if we break our nervous system down into anatomically distinct things like the central nervous system and the peripheral nervous system, the central nervous system is our brain and spinal cord. The peripheral nervous system are all nerves that run through our body that aren't in the brain and spinal cord. We've got the afferent nervous system, which feeds information in through the peripheral nervous system into the brain. And so the afferent nervous system is a lot of our sensory stuff, so taste, smell, touch, sight, all that sort of stuff, through the afferent nervous system. And the efferent nervous system, which I remember by thinking it F's off of the central nervous system, and goes into two ways. One pathway is our somatic nervous system. So if I want to intentionally move my hands around, then I'm doing that through the afferent nervous system, through the somatic meaning, soma meaning body. And the other system is the autonomic nervous system. And that's the system I want to talk about. And hopefully you've got some familiarity with the idea of the sympathetic nervous system and the parasympathetic nervous system. The reason I'm giving this talk is so that you can understand why we, as paramedics, play around a lot with the autonomic nervous system. And a lot of the drugs that we use directly affect either the sympathetic or the parasympathetic. And what I hope to get across in this is how we are affecting them and some of the terminology that we use as we play around with the autonomic nervous system. So let's take a look at that. The autonomic nervous system, as we said, has the sympathetic branch, which we usually call the SNS, and the parasympathetic branch, which we call the PNS. The sympathetic nervous system in most textbooks is usually red because it's the active one. The parasympathetic nervous system is usually shown in blue because it's nice and relaxed. So sympathetic nervous system, parasympathetic nervous system. You've probably heard of the SNS referred to as the fight or flight system. And it's a really important concept to keep that in mind. And the PNS referred to as the rest and digest. So keeping these systems clear on what they do to different organs, which we'll talk about in a minute, if suddenly you're attacked by a bear, it's the sympathetic nervous system. And I always get these mixed up, so sorry for getting my words mixed up, but I constantly do it, so I'll try and keep it straight. So if you're attacked by a bear, it's your sympathetic system which is going to activate, and we're ready to either fight that bear or run away from the bear. If you're relaxing around a campfire, having a glass of wine with your sweetie by your side, and it's all very good, and someone's playing the guitar, and you're laughing, and it's wonderfully relaxed, then that's when we're resting and digesting with our parasympathetic nervous system. So understanding those two and what they do is important. And of course, you can't do them both at the same time. You can't be excited and relaxed at the same time. So usually if something relaxes you, it stops you from being excited. Or if something excites you, it stops you from being relaxed. You can't go and stop at the same time. And that gives us our first basic principle, or first rule. Should have called it a principle. And that is the seesaw effect of the autonomic nervous system. If one's up, the other's down, like a seesaw. If the other goes up, then the first one goes down, like a seesaw. You can't have both ends of the seesaw up or down at the same time unless it's broken. And assuming your autonomic nervous system is working properly, then you won't have both branches activated at the same time. It's one or the other. So if you turn up the sympathetic nervous system, you're automatically going to be turning down the parasympathetic. Conversely, if you turn down the sympathetic nervous system, you're automatically going to be turning up the parasympathetic. Think about that for a minute. Make sure you got that straight in your head, but it's one or the other, like a seesaw. Okay? What happens if you turn on the sympathetic nervous system? Well, what happens when you're attacked by a bear? The way to remember the effects on the different organs is to think about what happens when you're really scared or really nervous. So if you're attacked by a bear, the first thing that's going to happen is your pupils are going to dilate. You want to see what's going on. You want to have an idea of what's happening. Interestingly enough, When we are falling in love, we're excited, and our pupils will dilate at that too, which is one of the reasons why we think that blue-eyed people are typically more attractive, because we can see their pupils dilate if they are attracted to us. And people with brown eyes, like me, are considered to be more inscrutable. We can't tell as well what's going on, because with their dark eyes, we can't get a feel of the reaction that we're getting from them. So pupils dilate when we're excited. Think about a blue-eyed person. Eyes dilate when they're in love, and you can see that and go, oh wow, this is great for me, because they're obviously in love with me, or they're very scared of me, which is obviously not so great. Our tears tend to stop when we're very excited. Generally, the sympathetic nervous system is a dry phase, and the parasympathetic nervous system is wet. If you think of it that way, that helps a lot. So our tears stop, our mouth gets dry. You guys probably know if you stand up in front of the class to talk, suddenly you got no saliva left in your mouth anymore, because your sympathetic nervous system has been activated and it's drying up your mouth. Conversely, we do start to sweat with the sympathetic nervous system. So I guess that's a bit of a breaking of the rule of dry and wet. But if you think about the fact that all the patients that you see in shock are pale and diaphoretic, it's because their body is going, oh my God, something's happening, and they've turned on the sympathetic nervous system. So the blood vessels that go to the external part of the skin, they all shut down, because our body says, I don't really care about dilating the periphery. I need all that blood right now for my muscles. And it also starts to sweat, because it figures you're about to be fighting or running, and it's going to need to cool down. So you start to sweat. Your heart speeds up. Your lungs dilate, because you're getting ready to really run or really fight. You're going to need some sugar. So your liver starts to break down the glycogen that it has stored in glycogenolysis, and it releases from the glucose that it's broken down from the glycogen out into the bloodstream. So suddenly you get this rush, and you're feeling more energetic, because there's all of this sugar now into your bloodstream. As I said, your skin blood vessels constrict, but the blood vessels in your muscles dilate so that you're ready to run or punch or fight or whatever you need to do. This isn't a time for digesting your food, so your digestive system just shuts down, which is one of the reasons why people have been in car accidents, and we go and we see them, and we take them out, and they go, oh, I feel kind of sick to my stomach. The reason they're feeling nauseous is because whatever food they have in there, which was happily being digested and, all moved around, everything, the digestive system is just shut down, and their GI tract is just sitting there, bleh, and they feel nauseous because they don't have a lot of blood going to the gastrointestinal tract, and they're not digesting their food. Your bladder itself actually relaxes, because it takes energy to keep that toned up, and you don't need that right now, but the sphincter's closed. So typically people aren't peeing, because right now's not the time to pee. Our genitalia in general shuts down, because fight or flight is not sexy time for most people. So our genitalia has decreased autonomic innervation, is how we'd say it. On the other hand, if you think about the parasympathetic nervous system, it kind of does the opposite of that. So when you're relaxed, your eyes can constrict, because you're not out looking for danger. You can just relax. You're eating the rest to digest, sort of thing, so your body is prepared for that, and you get a lot of saliva. The saliva is produced. In fact, if you are poisoned by a drug that kicks your parasympathetic nervous system into overdrive, then one of the things that you see start to happen is people start drooling, sludging out a whole lot, because the parasympathetic nervous system has been overactivated. Your skin vessels aren't really attracted. The bronchioles constrict, and we also get a lot more mucus coming into the bronchioles, and that's a time for our lungs to clean themselves. And I've done another lecture on pharmacology that talks about that. So I think of it as a dishwasher. The door shuts, it shuts down and starts washing around a whole lot, and that's the last thing you want to have happen when somebody's having an asthma attack or a lot of problems breathing. So we give drugs that block the parasympathetic nervous system, and that helps the respiratory system to breathe. Talk about that a little bit later. We're not about to fight, so our heart can slow down. We can direct energy somewhere else. We don't have to overwork the heart. The GI tract is working very well, because this is rest and digest. So this is what we like to do when we're digesting our food, which is why people after a meal go and sit on the couch and they socialize, and it's all very nice because they're activating their parasympathetic nervous system by socializing, and that aids in digestion. That's why we do it. The muscle vessels, do they dilate? Not so much, I didn't think. Not sure about that one, but I'm not going to go record the whole thing. And the bladder walls will, the bladder walls will contract and the sphincter relaxes, which allows you to pee. And if you think about it, you can't pee when you're scared. You kind of have to be relaxed. If you're standing at the or sitting at the toilet, as the case may be, and you're just about to pee and the doorknob starts to rattle, your sympathetic nervous system turns on a little bit, parasympathetic shuts down, you're not relaxed anymore, and you stop the flow. Okay, so that's what they do. And if you think about it, let me just go back one slide for a second to the sympathetic nervous system. This is kind of the stuff we want to do to our patients. Most of our patients, as paramedics, are in extremis. So they're having a lot of trouble. And we want to increase their heart rate. We want to vasoconstrict them because they're going into shock. We want to bronchodilate them because they're having trouble breathing. So the sympathetic nervous system is really what we are trying to activate more as paramedics. This is generally our goal. So past the parasympathetic now. And I want to introduce the terms mimetics and lytics. And the reason I'm introducing these terms is because we could really simplify the language of the autonomic nervous system, but we haven't. We've kind of gone the other way, and there's a whole bunch of confusing ways to describe turning on or turning down the sympathetic nervous system, or turning up or turning down the parasympathetic nervous system. So let's start talking about those words. And the first words we're going to talk about are mimetics and lytics. So mimetic sounds a lot like mimicking, or I'm mimicking something. So if I give you a drug which acts as a sympathomimetic, it's mimicking the sympathetic nervous system, which means we're turning our sympathetic system on. If I give you something that is a parasympathomimetic, then that means it's mimicking the parasympathetic system and it's turning your parasympathetic nervous system on. So mimetics turn on the particular system. Sympathomimetic, parasympathomimetic, depending on which one you want to turn on. Sympathomimetics will get the sympathetic nervous system going, and then, because of the seesaw principle, turn down the parasympathetic nervous system. And a parasympathomimetic will turn up the parasympathetic nervous system, and because of the seesaw effect then, will turn down the sympathetic nervous system. This is usually the opposite of what we want to do. Lytic is the opposite of mimetic. Lytic comes from the Greek luisis, which means a loosening, and when we're talking about the autonomic nervous system, we could say we're like loosening the energization, or we're blocking the particular part of the autonomic nervous system that we're talking about. So a sympatholytic is blocking the sympathetic nervous system, and by seesaw effect, that means it's turning up the parasympathetic. The parasympatholytic is blocking the parasympathetic nervous system, pulling it down, which means, of course, we pull up the sympathetic nervous system. So mimetic and lytic, two important words to understand. One means a turning on or a turning up, and one means turning off or turning down. Now I want to talk about agonists and antagonists. Next thing. So put away mimetic and lytic, and let's just talk about a whole new thing, which are agonists and antagonists, which hopefully you're familiar with. Thank you very much to this website for giving me this great diagram, so I don't have to do it. If we take a look, let me use my mouse here, at agonists, this is a drug that acts as an agonist. It goes into a receptor, and that receptor is attached to some sort of target cell, and when an agonist goes into that receptor, the target cell goes, yes, and it starts to work, and then whatever that target cell does, where's my mouse, it goes and activates it. If we go over here, though, this is an antagonist, and an antagonist goes into that receptor, and it blocks it without activating the target cell. I tend to think of agonists as the finger that comes and turns on the light switch, and antagonists as the piece of tape which covers up the light switch so that nobody can use them. And of course, in the real world, there's more than one receptor. You'll have hundreds or thousands of receptors in an area. And if you have some agonists and some antagonists, the antagonists will block some of those receptors and they won't all fire, so you'll get a little bit less activation. So the take-home lesson from this little bit is that agonists turn on, oh, the agony, it's all heightened. Whereas antagonists, if somebody is antagonizing you, they're shutting you down, they're irritating you, it's a negative thing. So think of agonist as turning on or turning up, and antagonist as turning down or turning off. How does that work in our bodies? Well, in both the sympathetic nervous system and the parasympathetic nervous system, we have receptors. And when we turn on those receptors, they turn on that part of the autonomic nervous system. So in the sympathetic nervous system, the neurotransmitter that generally turns on the receptors in the sympathetic nervous system is noradrenaline. In the parasympathetic nervous system, the neurotransmitter that activates or turns on the parasympathetic receptors is acetylcholine. And from those two neurotransmitters, we get the name adrenergic. So adrenaline, it's an adrenergic receptor, a receptor that receives adrenaline. And on the parasympathetic side, we have cholinergic receptors, which receive acetylcholine. That's where we get the colon from. Choline, well, cholin's a different thing. Choline. So we've got adrenergic receptors, which activate the sympathetic nervous system, and we've got cholinergic receptors, which activate the parasympathetic nervous system. So if we get an adrenergic agonist, which is turning on, like noradrenaline is, it turns on the sympathetic nervous system. However, if we get ourselves an adrenergic antagonist, it's going to sit in the adrenergic receptor and not allow the sympathetic nervous system to be turned on. So if I give you an adrenergic agonist, it turns on the sympathetic nervous system, turns off the parasympathetic. If I give you an adrenergic antagonist, it's going to block the sympathetic nervous system and allow the parasympathetic to become dominant. Think about that. Next one is a cholinergic agonist. So if I give you a cholinergic agonist, it's going to turn on your parasympathetic nervous system, turn down your sympathetic. If I give you a cholinergic antagonist, it'll push down, block the parasympathetic, and that makes the sympathetic ascendant. So sympathetic turns on. Stop the video for a second and think about it if you need to. It's not difficult, but it's kind of confusing when you start throwing them all together. So let's take a look at this. If I want to turn on the sympathetic nervous system, I can either give you an adrenergic agonist, stimulating, turning on, or I can give you what? I can give you a parasympathetic or cholinergic antagonist. So from that we get our next rule. Adrenergic agonists turn up the sympathetic nervous system, and cholinergic antagonists also end up turning on the sympathetic nervous system by turning down the parasympathetic. If we go the other way, if for whatever reason we wanted to turn on the parasympathetic, can you think of the names of the neurotransmitters that we want to put into there? Think about it. We're going to put in an adrenergic antagonist. It's blocking the noradrenaline or the sympathetic nervous system so that we shut down the nervous system and thus make the parasympathetic work more. Or we can give a cholinergic agonist, and the cholinergic agonist works like acetylcholine, which turns on the parasympathetic nervous system and consequently by seesaw turns down the sympathetic nervous system. So that's our next rule. If we want to make the parasympathetic nervous system more active, we can either give an adrenergic antagonist or a cholinergic agonist. Okay? All right. Let's summarize that with a set of rules that we'll go through slowly. First of all, the seesaw effect. If you turn up the sympathetic, you're turning down the parasympathetic. Rule 1B, rather. If you conversely turn down the sympathetic, you're turning up the parasympathetic. Next one, we're going to talk about mimetics and lytics. Mimetic means to mimic, so a sympathomimetic turns up the sympathetic nervous system, and a parasympathomimetic turns up the parasympathetic nervous system. Rule 2B, lytic, not sympatholytic. That's a typo. Sorry, lytic means blocks. So sympatholytic is blocking the sympathetic nervous system, and a parasympatholytic is blocking the parasympathetic nervous system. Okay, I'm getting confused too. Since the sympathetic nervous system uses noradrenaline as a neurotransmitter, we call it an adrenergic receptors. Adrenergic agonists turn on those receptors, and cholinergic antagonists turn down the parasympathetic nervous system. So also the antagonists, turning off the parasympathetic nervous system, give us more sympathetic nervous system activity. And the converse is true too. The sympathetic nervous system, that's a typo too, sorry. The parasympathetic nervous system, so rule B is the PNS, uses acetylcholine as a neurotransmitter. It's like 7 o'clock at night, sorry. And we call them cholinergic receptors. I gotta remember to fix that. So cholinergic agonists are going to agonize or turn on the parasympathetic nervous system. Yes. And adrenergic antagonists are going to turn down the sympathetic nervous system, which turns up the parasympathetic nervous system. Okay? So remember the typos if you print out this screenshot or something, that you have to correct that little bit. Okay, let's see if we've got this right. So on the left side of the screen there, we're trying to activate the sympathetic nervous system. And on the right side, we're trying to activate the parasympathetic nervous system. So what would I want to do to activate my sympathetic nervous system? Let's look at the left side first. I'm going to want to give a what? A sympathomimetic or a sympatholytic to get the sympathetic nervous system working. And what about the parasympatho? Is it a mimetic or a lytic? And then in the adrenergic and cholinergic, are you going to give a agonist or an antagonist? When I say now, stop the video and fill in those blanks, and then I'll give you the answers. Okay, now. Okay, here come the answers. So if we want to turn up the sympathetic nervous system, we're going to give a sympathomimetic to turn it up, or we're going to give a parasympatholytic, which turns down the parasympathetic nervous system and seesaws the sympathetic nervous system up. Or we give an adrenergic agonist to turn on the adrenergic receptors, or we give a cholinergic antagonist, which blocks the cholinergic receptors. And similarly, but oppositely, ipsilaterally, contralaterally, I don't know, on the other side. So that's how we use the terminology. This is a focus on the words we use, which are confusing, honestly and admittedly, and we apologize. I didn't do it. I had to suffer through this too when I was a student. But it is confusing. So, why do we care? Well, as I said, the reason we care about this as paramedics is because generally our patients are in extremis, and what we want to do is activate the sympathetic nervous system or augment it, because normally it already is activated. We show up to see most of our patients and they're not, resting and digesting, they're fight or flighting because their sympathetic nervous system has been activated. They're sympathetic dominant. So when we use these different types of drugs that we carry as paramedics, and I'm going to talk about a bunch that basic level paramedics and advanced level paramedics, and some that critical care paramedics use, just to sort of give you an idea for whatever level you're at to help understand. We target usually the heart, the lungs, the blood vessels, and the brain. And that's what we're trying to affect. So in the heart, if we want to activate the sympathetic nervous system, then we can give adrenaline or noradrenaline, which we usually run through a pump, or isoprenaline, and we give dopamine. Dopamine, not so much anymore. Dopamine was a drug that we used to use a lot back 90s or so when I was working in Toronto. But we really don't carry dopamine too much anymore. You might still sometimes see it used as a drip. Usually it's run through a pump. But all these catecholamines usually we're very careful with, except adrenaline, we're a lot more aggressive with adrenaline. So that's turning on the sympathetic nervous system. Are there any drugs that turn off the parasympathetic nervous system so that the sympathetic nervous system can be dominant again? Yes, there are. We can use atropine and we can use glycopyrrolate. Glycopyrrolate is used a lot in anesthesia. So what those do is, if you think of there being a gas pedal on the heart and a brake on the heart, unlike a car, you can't push both at the same time, but you can take one off. So if you think of all the adrenergic agonists, so the adrenaline, noradrenaline, isoprenaline, dopamine, they're pushing down the gas pedal. And if we really want to get going, then we can give atropine or glycopyrrolate, and they take off the brake. So you're hitting the gas and you're taking off the brake, and hopefully, boom, it starts to go. An interesting sort of side note is that atropine and glycopyrrolate can also be used for their effects on salivary glands. And what do you think they would do? If we're turning off the parasympathetic nervous system, and we know that the parasympathetic nervous system has what effect on the salivary glands? It makes them work. So when we're resting and digesting and eating, we have a lot of saliva. When we're nervous up in front of the class and sympathetic, we don't have much saliva. So if we turn off the parasympathetic nervous system, it's like turning on the sympathetic nervous system, and giving atropine and glycopyrrolate will dry you up. And they're used as drying agents in anesthesia. The other thing that atropine does, should I get into this? Sure. We can use it sometimes when we're about to intubate kids, because kids have very sensitive vagus nerves, and vagus nerves are a parasympathetic nerve which slow down the heart. So if we give atropine, it blocks the vagus nerve, and it makes it difficult for kids to brady down. And often when we're putting a laryngoscope into kids, because we stimulate the vagus nerve, we're like hitting the parking brake, if you want to think of it that way, in their heart. And we, start to futz around a little bit in their airway, and they start to brady down. We go, oh crap, they're really sensitive, they're really vagal. So we'll stop, or we avoid getting into this problem in the first place by giving them a little bit of atropine, and that turns off that parking brake so that when we go and we're stimulating the vagus nerve, they don't brady down anymore. So that's some of the functions that we use for atropine and some of these heart drugs. In the lungs, if we want to stimulate the bronchodilation, we can give salbutamol or Ventolin, and salbutamol gives us a bronchodilation. Or we can turn off the parasympathetic nervous system so that we get more sympathetic innervation, and we can give ipratropium bromide. And ipratropium bromide stops the bronchioles from constricting, and it stops that excretion of the saliva and mucus in there, so it helps open up and dry out the lungs. Another name for ipratropium bromide is Atrovent. So where we use atropine for the heart, we use Atrovent, or ipratropium, same drug, for the lungs. And then we take a look at the blood vessels, and we've got a whole bunch of vasoconstrictors that we can use. Of course, adrenaline, and adrenaline's great because we can give it every way. You can give it intranasal, you can give it nebulized, you can give it IM, you can give it subcutaneous, you can give it IV. You have to be pretty careful giving it IV, but you can. Again, we can use dopamine as a vasoconstrictor, not used so much. Metaraminol is a good blood vessel constrictor, and we use that if people are really vasodilated, especially in one particular instance that we might run into pre-hospitally. If we give nitroglycerin or glycerol trinitrate, GTN, they call it in Australia, nitro in North America. If we give nitro to a patient who has also taken a phosphodiesterase inhibitor, so something like Viagra, a boner medication, then those two drugs interact and cause a really profound vasodilation. In fact, Viagra was originally tested as an antihypertensive, but what they found in all the drug trials was that everybody they were giving this antihypertensive to got a boner. And they realized, holy crap, we've invented a boner pill and we can make billions from this, which they did. So they remarketed it. It's not supposed to be, it's not used really as a vasodilator antihypertensive anymore. It's used as a selective vasodilator to the genitalia. And if you give someone who's having chest pain, who's taken Viagra or a phosphodiesterase inhibitor, a bit of GTN, those two antihypertensives mix like a Macbeth's witch's brew, and they create agents that cause profound vasodilation throughout the body, and people can die from that. That's why we're very careful, and you should always ask everybody before you give GTN if they've had any phosphodiesterase drugs. Because if they have, it's a problem. And women take this, and kids take Viagra and drugs like that as well. For women, it gives genital flushing. For kids, they mix it with ecstasy and make a drug called sextasy, because ecstasy makes you very amorous and loving, and the phosphodiesterase inhibitor gets you your genitalia sexually prepared for it. So it's a rave drug. So you might find some kids who've done sextasy plus cocaine, they're having a heart attack, and you think, well, there's no way they've taken a phosphodiesterase inhibitor, and boom, they massively dilate and they're in real trouble. Anyways, when you run into that situation, meterminol can help because it's a profound vasoconstrictor, and it works very well in that specific situation. Cofenalcaine is a mixture of phenylephrine, which is a potent vasoconstrictor, and lidocaine or lignocaine, same drug, just depending on what side of the pond you're on. And so if you've cut yourself and we want to suture it up, we can put some cofenalcaine in there, and the phenylcaine constricts the blood vessels so it stops bleeding, and the lidocaine or lignocaine is an anesthetic. It's a sodium channel blocker, so it blocks the nerves from being able to work properly, and it can't send pain signals anymore. So we'll use that for its sympathetic effect of vasoconstriction. Oh, I thought I had some. No, I guess I don't. And also centrally, we use another drug which blocks the parasympathetic nervous system called benztropine. And if people are taking some antipsychotic meds, they can get into a problem with extrapyramidal syndromes, which is not at all anything I'm going to go into. But sometimes you can see people running into this particular problem, and we can give them an anticholinergic. That's usually not the same sort of, heart, blood vessels, lungs, really important sort of stuff for keeping you alive. But it still is a use of an anticholinergic clinically by paramedics. Okay, so hopefully, sorry for the mistakes, but I hope I made them clear. What you've got now is an idea that we have an autonomic nervous system, and a sympathetic and a parasympathetic. And it works like a seesaw. Sympathetic revs us up, gets us going. Parasympathetic, when it's dominant, makes us relax and digest. And we have a lot of confusing names for things that turn on or turn off the sympathetic or the parasympathetic, and there's a lot of combinations that you can mix around. But at the end of the day, what we're trying to do as paramedics almost all the time when we're playing with the autonomic nervous system is trying to augment the sympathetic nervous system and turn down the parasympathetic nervous system. I hope that helps. If you have any questions, feel free to post them up here. Happy to answer them. If not, thanks for watching.